in Pittsburgh, we have quite a large hemophilia population with the Amish community just hours away. And in recent years, we've had great success in their outcomes because of the development of Emicizumab. What Emicizumab is it kind of acts as factor VIII, which is the problem in this disease, and it prevents patients from needing recombinant factor VIII. And why that's important is that the problem with receiving factor VIII frequently is your body can develop inhibitors to that. And if that occurs, we really don't have very many options for treatment of bleeding episodes. So with Emicizumab, we've had a great reduction in annual bleeding rates in this population, which has been amazing. But what we don't know is what happens to inhibitors. The way to kind of get rid of inhibitors is to give small doses of factor VIII very frequently. And we don't know if we need to continue doing that for the patients who are receiving Emicizumab prophylaxis. What our study was looking at is this exact question, is do we need to continue giving these patients factor VIII routinely to prevent the production or recurrence of factor VIII inhibitors in those who have been tolerized? And what our small kind of pilot study is showing is that we may not need to. We had about 70 patients, and we only had one patient who had recurrence of inhibitors while on Emicizumab. So these are small numbers and limited by kind of the practice just now starting of sending inhibitors on those patients on Emicizumab. But it is kind of promising for the future that these patients may not need to receive these prophylactic small dose of factor VIII.